Hey everybody, I just wanted to take a moment today to talk about my thoughts on a recent article that has been circulating all over the news, all over social media regarding fluoride exposure prenatally. So this study was first published in the Journal of the American Medical Association, otherwise known as JAMA, in their pediatrics journal. And so what this study showed is that there was an association between a mother's prenatal fluoride exposure. And so that exposure came from tap water mainly, but then just other various sources of fluoride in the diet. The association of the prenatal exposure and then a child's IQ around the age of 3 or 4. And so the concerning thing is that the association that was shown is that in the children that were exposed prenatally or in utero to fluoride, especially the boys versus the girls, they had a lower IQ when they were tested at about the age of 3 to 4. So of course this is certainly concerning, but a few of my thoughts. So the first thing is that, this is just an association. This is not cause and effect by any means. This is a sample of, I believe, about 400 to 600 pairs of parent and child. So, and this was also based in Canada. So trying to generalize this to the population as a whole is a little bit hard to do, but it should certainly be thought about. And it shouldn't be taken lightly by any means. I certainly think more studies are needed. The other thing to consider is that there was a difference in the IQ between girls and boys. So it doesn't make a whole lot of sense that the fluoride would selectively, be more detrimental to the boys' IQ rather than the girls. There's something to be said for, maybe there is another factor at play there, not just the fluoride exposure. But with all of that said, I think it's really important to share my thoughts as a pediatric dentist on fluoride. This just kind of goes for our patients and potential patients. I just want everybody to be aware that at our office, fluoride is a choice, as it should be at any office. I will never push fluoride on any family. It has to be something that the parents and the patients feel comfortable receiving. It's never something that, has to happen. What I do think, though, is communication is super important. And so when I'm recommending fluoride, I'm recommending it mainly for children with high risk of getting cavities. Children who have had multiple cavities or have multiple areas that would be considered pre-cavity areas, so to try and prevent those spots from getting bigger. And if it's a child that has a very low cavity risk, I won't even bring up the fluoride because I don't think it's necessary. So that's just my opinion. And even in a family that I have recommended fluoride to because they have high cavity risk, if they choose not to get it, that's still fine. That is still okay because, again, it's all about choice. It's all about understanding the benefits of the proposed treatment. And if for whatever reason that just is not comfortable for the family, then that's okay. And I just want to stress that obviously if you have another dentist, we're not your dentist, that you have that communication with the dentist and you do discuss the cavity risk and what types of benefits the fluoride might have for you or your child. It just isn't a thing that has to be done. But with that said, it really, really is helpful in some patients, especially those with high cavity risk. So this research and this study that was published, I don't think it should be ignored by any means, and that's why I wanted to bring it up, because I've already been getting some questions about it from some parents. And I think it's important to be aware of, but also just be aware that there's, more to this study perhaps then was explained. And what I mean by that is, the fluoride is a big component, and that's what was studied, but we can't account for all the other differences between these groups and these families that may also have attributed to the lower IQ scores. And then again, taking into account that, this was 400 to 600 families, and that certainly is not something that can be generalized to the population as a whole. And so those are just important things to keep in mind. But with that said, again, communication is key. Discuss these things with your dentist, and at the end of the day, just make the choice that feels right and feels comfortable for you and for your family. All right, have a great day, everybody.